Hi, hello everyone. I am Sridharan, Assistant Professor from the SNS College of Physiotherapy. In this video, we're going to see about the topic which is Syringomyelia. What is syringomyelia? Syringomyelia, it is nothing but a chronic disorder characterized by the fluid-filled cyst in the spinal cord level. Okay, it is also called as syrinx. Syrinx can be expanded and elongated over the time. According to the severity of the condition, it gets elongated inside the spinal cord. And the syringomyelia, it is caused by the formation of syrinx in the spinal cord and often due to disruption in the cerebrospinal fluid. The causes can be classified as three different categories. First one is congenital and acquired, and third one is idiopathic. Pathology. According to the pathology for the syringomyelia, first the formation of syrinx at the central canal of the spinal cord, and then it finally leads to the disruption at the normal flow of cerebrospinal fluid. And third, it finally affects the cervical upper thoracic spinal cord levels. Generally, the syringomyelia is classified into three types. They are congenital type, acquired type, and third one is idiopathic variety. Causes for the syringomyelia are, first one is Kyrie malformation. This is most commonly seen in the congenital conditions. Then second, it is an spinal cord trauma or surgery. Third, spinal cord tumors, and fourth one is arachnoiditis, or it's also seen in the meningitis conditions, and finally it can be also seen in the spinal cord tethering or deformities conditions. First, we're going to see about the congenital causes for the syringomyelia. Generally, during congenital factor, first the Kyrie malformation leads to the syringomyelia. Then it also involves download to the basement of the cerebellar tonsils through the foramen magnum. Then it finally leads to the obstruction in the normal cerebrospinal fluid flow. It leads to the syrinx formation. It is also known as the spinal dyspharism, which it can lead to the spina bifida, tethered cord, or else also myelomyelingiosis. It leads to the result in the abnormal spinal cord mechanics and also the CSF fluid mechanics. In acquired causes, first one is the trauma or injury cases leads to the acquired condition. Then it also caused due to the spinal cord tumors, and due to the tumors in the spinal cord, it finally leads to the meningitis, or also known as the arachnoiditis. Due to this, frequently due to infections can also cause the syringomyelia in the spinal cord, and after that the spinal cord injury or radiations can also lead to the some of the acquired causes for the syringomyelia. And it is also caused to the hydrocephalus. Increase in the intracranial pressure and the altered CSF dynamics can cause the syringomyelia, especially when associated with the hindbrain herniation. And third cause is idiopathic cause. Idiopathic is nothing but an unidentifiable. It is also called as an idiopathic cause. For this causative factor, the diagnosis is made after excluding all other structural and acquired abnormalities, typically detected incidentally or when the symptoms may appear. General clinical features for the syringomyelia are, first one is cape-like distribution of the pain and temperature loss. Then next, the muscle weakness and the atrophy can also causes the shows the clinical feature for the syringomyelia. And then third, spasticity in the lower limbs. Especially in children, the scoliosis is one of the major clinical feature in the syringomyelia. And finally, it can lead to the bowel and bladder dysfunction in the advanced cases. Next. Investigation. General investigation for the syringomyelia. First one is MRI spine. The MRI spine, it is a diagnostic test of choice which visualizes the syrinx and as well as also the associated anomalies. Then second, CT myelopathy. It is usually used if MRI is contraindicated. Then third one is a neurological examination. During neurological examination, the sensory dissociation which shows us the temperature pain and temperature loss, but also shows the preserved touch sensation. And finally, CSF studies if infection or inflammation if it is suspended. So these are the investigative methods which is used to identify whether the patient is affected by syringomyelia or not. So other categories I'll see you on the next video. Thank you.